Hello friends, welcome to classes by Lab Doctor. I am Dr. Divya, and in today's class let us discuss about what are the causes for this low sperm motility and how do we treat it. So, in the previous classes we have discussed that we categorize the motility of the sperm as progressive motility, non-progressive motility and immotile sperms. Progressive motility means these sperms are moving very rapidly. They might be moving in a linear fashion or they might be moving in large circles, but they are moving very rapidly, and these represent the best quality of sperms. So this progressive motility is further classified as rapidly progressive and slowly progressive. So what do you mean by slowly progressive? Slowly progressive means these sperms are moving or progressing, but they are moving. They are not moving at a very fast pace, but they are slowly progressing either linear or in a large circle. Then comes non-progressive motility. These sperms are not progressing. They are not moving in a linear fashion or in large circles. Their tail might be moving or their head might be moving in a very, it is displaced at a very around 5 micrometer only. So those are the non-progressive sperms. And then there are few sperms which may be immotile. They are not moving at all. So this is called as immotile sperms. Suppose if the motility of the sperms comes less than 50%, we need to do other tests like semen, sperm vitality, etc. So sometimes the same thing is classified as grade A, grade B, grade C and grade D. Grade A being fast or rapidly progressive, grade B is slowly progressive, grade C is non-progressive and grade D is immotile sperms. This slide you can see that there are sperms which are rapidly progressing. So they are moving very quickly, and they are moving in either linearly or they are moving in large circles, and they're traveling from one point to other point. You can see that they are moving from one point to other point very quickly. The distance is more than half the tail length. Within 1 second they are moving from one point to other point. Here you will see a slowly progressive sperm. It is moving, definitely it is moving in a circle or in a linear way, and but the distance which is traveled from one end to other end is less than 25 micrometer or half of the tail length. The distance is covered, but it is moving slowly, it is progressing. So this is slowly progressive category. Here you can see some sperms which are not moving, or they are non-progressive sperms. So here you can see only their tails are moving, the flagellas are moving and the head is not moving. Even if the head is moving, it is less than 5 micrometer the displacement. So these are the non-progressive sperms, only the tail or the flagella being moving, and they are not progressing at all. Here you can see some sperms, they are totally immobile, they are just not moving. So these are called as the immotile sperms. According to the WHO criteria, the progressively motile sperms, their percentage should be minimum 32%, and the total motility when you take, that is progressive as well as the non-progressive, their percentage should be minimum 40%. The total motility, that is progressive as well as the non-progressive, that should be minimum 40%, and only the progressive motility, if you are taking the rapidly progressive, that is, even if it is 32%, that is fine. So this becomes very, very important. When the semen sample shows motility less than the reference range, that is called as asthenospermia or asthenozoospermia. When the progressive motility are less than 32%, or the total sperm motility, that is the progressive as well as the non-progressive sperms, which if they are less than 40% in that semen sample, then that is called as asthenospermia. So what are the causes why there is low motility sperms? It could be because of few genetic defects that causes low sperm motility. It could be an infection. It could be a sexually transmitted infection, or it could be a testicular tumor, testicular cancer, or a testicular surgery, which is affecting the quality of the sperms which are being produced. If the person was having an undescended testis, or if there was an injury, that can also affect the sperm motility, the quality of the sperm. If there was a varicocele, or if the person has been using a long-term anabolic steroid, that can also affect the sperm quality as well as the quantity. Suppose if there is abnormal semen liquefaction because of the problems in the male accessory glands, etc. Suppose if the semen remains coagulated, then it can hinder the sperm motility. If there is an inflammation of the sperm duct or the prostate glands, etc., that can also impair the sperm motility. And there are certain lifestyle and environmental factors like smoking, alcohol abuse, or drug abuse can alter the sperm motility. Or a diet which is deficient in vitamin C, vitamin B12, etc., that can also cause this fertility problems. In many of the cases, there may not be a valid reason for the low sperm motility also. So how do we treat the low sperm motility then? We will have to treat the cause. So suppose if it is a varicocele which is causing a low sperm motility, we need to treat the varicocele. Suppose if there is any infection, we need to treat the infection. Suppose if there was any hormonal imbalance or deficiency, we need to treat the hormonal imbalance. So these the cause has to be treated to improve the motility or the quality of the sperm. Certain lifestyle changes also makes a difference, like exercising regularly, maintaining ideal body weight, reducing alcohol, reducing smoking, reducing substance abuse like drugs, etc. can also improve the sperm motility. Now there are various other advanced modalities for treatment of infertility also, like you have IUI, IVF, ICSI, certain medications, etc. But remember, suppose if the person is having many non-motile sperms, or if the sperms are non-progressive sperms, then it is always better to go for intracytoplasmic sperm injection, because here we directly inject the sperm into the cytoplasm of the egg. So this would help the patient to conceive. Suppose if the quantity of the sperms that are immotile are more of a non-progressive one, or if they are very slowly moving, then the IUI, etc. would not help, because or it would not make much of a difference. So these are few of the treatment modalities which can be done to improve the sperm motility. So that is all about the sperm motility, the causes of low sperm motility, and how do we treat the low sperm motility. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.